Good afternoon, everybody. Thanks to the organizers of today's event. Thanks to all of you for being here for it. As Damon indicates, I'm Acting Assistant Secretary at the Administration for Children and Families, ACF. ACF is the part of HHS that is responsible for a wide range of programs at the federal level, principally ones that provide benefits and services for low-income children and families and communities. So within our jurisdiction, this includes, but is not limited to, domestic violence and child care and Head Start and child welfare and child support and temporary assistance for needy families, TANF, refugee assistance, runaway and homeless youth programming, programs addressing sex and labor trafficking, programs serving unaccompanied children, and more. So lots of programs. In many of these programs, there are goals to identify low-income, vulnerable populations, to connect them with appropriate assistance, to provide benefits and supports to strengthen families, and to promote economic mobility and financial security. So the reason I'm here today and have joined into the discussion is because we, along with many of our colleagues at HHS, think that there are significant opportunities to use new and emerging technologies to help to address these and related goals, and for startups and developers to be using government data to do so. In recent years, as you all appreciate, there have been extraordinary stories of innovations and technologies that are improving our lives in multiple ways and making us, we hope, healthier and safer. And there's been important progress in the use of health data, including the use of federal data that HHS has made available. But we think that there probably hasn't been the same degree of innovation and progress in a range of areas that relate to the needs of low-income people and low-income communities and the delivery of human services. Let me just give one example. If you envision a low-income parent in a wide range of communities across the country, if they lose their job, they're at risk of eviction and homelessness, they're struggling to get by, and they want to know who they can turn to for help. In many communities, there's not an easy way to get needed answers. There may be different kinds of help from different government and non-government agencies, but no single place to find it. If they connect with the providers often won't know what other providers do or what their eligibility rules are. Each eligibility process may be separate, and if they need to apply for multiple benefits and services, it may result in multiple applications with information needs that can be repetitive and duplicative. And in addition to that, there is no Amazon or Yelp or TripAdvisor or any other kind of website to bring together the shared wisdom of many others about the experiences of navigating the systems or the quality and the effectiveness of providers. So technology may not be able to address every issue here. There are policy issues, there's legal issues, there's other challenges, but there's also little doubt that technology could play a key role in making things better. So we hope that you and your colleagues will take on the very broad challenge of exploring how new technologies can do more to help low-income families and communities connect to needed benefits and services, identify opportunities for advancement, and spur innovations in the quality of the services that are available to them. We think that federal data that's collected at ACF and at other federal agencies can contribute to that effort. For us, as part of the overall coordination work at HHS, we created an ACF-wide health data initiative team to evaluate our unpublished data sets. Since 2012, the team has published 85 publicly available data sets on healthdata.gov. So there you can find, in these data sets, technical assistance information, program performance data, federal monitoring data from a variety of sources. For many of the programs, it'll include characteristics of those who are served, such as refugees or children served in the child care program. And we've got some program service locations and contact information by location and type on healthdata.gov. Our Office of Head Start has already developed a web-based tool for finding Head Start program office contact information, which is searchable by location, grant number, or center type. But for other programs in our data sets, we may not have all the information that is needed. We may be able to tell you where the state agency is, but that really doesn't answer the question of, if I need help in this community, what do I do, where do I go? But having the state agency information can then link you to other data to potentially integrate things in a way that, that we haven't, but perhaps someone could. So we think that our data can be useful for a wide range of purposes. We're mindful at the same time there's limitations and gaps in what the federal government collects and what it can make available, but it is a valuable starting point. And we hope that this and related conversations can spur discussion and exploration of what might be possible. So again, we thank you all for your interest and greatly look forward to today's exchange. Thanks.